Welcome, Dr. Guzman.
Thank you so much, Dr. Henry, for that kind introduction. I like that nickname. It suits me better than the nickname that I had received from the indigenous community where I used to work. And this isn't something I'm very proud of, but it wasn't my fault. But they call me Dr. Idere, which means Dr. Always Late. But it wasn't my fault, just to let you know. It was the transport always, because we needed to take the Social Security transport, and it was always late. But again, pleasure to be here. I'm really, really thrilled to be talking to this large community of practitioners and clinicians and people from all around the Caribbean. As you know, Costa Rica, where I am from and where I'm calling in right now, we have a large Caribbean coast, and we have a large Caribbean community. Although I self-identify as someone from the Caribbean, I am Central American, and I'm very proud to be one. So maybe that was something that was missing from my bio, is that I am born and raised Costa Rican, and is where I do most of my work, at least from the pandemic. I've been sitting in this office for a while now. Anyway, so it's a real pleasure. I'll do this in English. Of course, English is in my first language. English is my second language. Mi primera lengua es el español. So I excuse myself if I have a gaffe or if I make a Spanglish word. I think this is a community that probably understands that better than none. I also speak a little French, but I do not dare to do this in French for my French-speaking friends. So I have around 45 minutes for this conference. I look forward to reading your comments in the chat, and I will ask that you put some of those. I will ask that you write 1 or 2 words, sometimes even a little sentence. And I know there's 133 of you out there, but I'll try my best to keep an eye out for that. Okay, so if nothing else, I'll start sharing my screen. And I want to start by getting a feel. Let me open the chat. Oh, this is a Zoom question, actually. Getting a feel by who is in the crowd, and I'll tell you why I'm asking this in at the end. So if you could just click on what words or best describes you as a health professional, as a primary care clinician, hospitalist clinician, public health policy, public health implementation, administrator, or other. And if you don't find yourself in that, you can put your other and type it in the chat. Let's see. You should be seeing your poll right now. I'm not seeing the results, though. I think oh, wow, this is a great, in the sense that there is a wide variety of people here. In case you're seeing the results, most of you are working either as a clinicians, be it primary care or hospitalists. Some of you are working in public health, more in the policy side. Some of you are working more in the implementation side. I don't have a lot of administrators, which I think they should be part of this course more. And maybe next year we can try to bring them in more, as the teams are needed for these approaches. And then others, I'm seeing people doing that are researchers, people that are mental health providers, people that are doing marine wildlife conservation, environmental students. So thank you. I'm also happy to see students that are eager to learn about this. So thank you for that, for sharing. So today we have these are our objectives for today. You've probably seen them. There are some that I won't get too neck deep into it. Some of them will brush and probably borrow from examples and not go deep into theory. It is not my intent to go deep into climate change equity theory. It's more of my intent to give you a broad overview of what these things mean for you as clinicians in public health and other types of professionals. So we'll define what climate health vulnerability and resilience is. We will identify some of the social and environmental determinants of health that makes individuals and communities more vulnerable or more resilient to health-related threats, to climate health-related threats. We'll try to apply the vulnerability and resilience framework to specific populations, especially the ones that are more at risk. We'll try to, through examples, describe the unique vulnerabilities of certain populations. And then we'll think of what is our obligations and what are our next steps moving forward. And that relates also to just what the organizing group will talk to you about at the end. So let me start with this question. And my idea was to create a word cloud here, but we had some technical glitches. So if you could, and thank you for the activists in the room, if you could type in the chat, and I know this will get very messy very quickly because there's a lot of you, what factors make a person or a community more susceptible or resilient than others to climate change? And I've taken the time to look at all of your slide decks. I haven't watched the presentations leading up to here. So I know you've been exposed to this jargon before. So adaptability, very good. I'm going to try to read them out loud as I see them. Age, resources, lack of knowledge, preparation, social support, lack of information, demographics, socioeconomic status, resilience, poverty, resources. This is a lot. Socioeconomic status again, education, awareness, gap in information, gender, medical conditions, traditions, culture, age, experience, lack of education. Great. These are great. And of course, a lot of you are working in communities that are trying to look at these factors and trying to improve some of these. Some of these, of course, are very hard to actually work upon, like, let's say, geographical location. If you have a town that is in a flood area, so to speak, it is hard to move the whole town to a non-flooded area. However, there are things that you can do as community members, as part of the community, or as outsiders of the community to increase or decrease the risk of something happening to that community related to, let's say, flooding, right? So some of these are easily changeable. Some of these factors, you can change the risk profile, so to speak, and some of them are things that you can't really actually do much about it. So keep that in mind as we're going through this conversation on where are these easily modifying factors, where are factors that are more hard to modify, where are factors that are almost out of reach into what we can modify. So let's start this conversation. And I know you've gone over some of these concepts in your previous presentations and classes, but let's just make sure that we are all in the same baseline, and it doesn't do any harm to go over these again. So let's start by understanding the concept of risk, and you've classically likely seen risk in this graph or a similar version of this graph being spoke as the combination of these three elements: hazard, exposure, and vulnerability, right? And I want us to understand risk as well, adding this fourth component, which is this response component, and I'll explain to you what I mean by this in a second. So when we say when we try to evaluate risk, when we say word risk, when we are using the framework of risk, we're basically speaking of the potential, right, of consequences where something that we deem is valuable is out at stake, right? Let me just say that again so it's clear. When we're talking about risk, we're talking about something that might happen, that is a potential, right? Something that might happen, a potential for consequences, where something that we deem that is valuable, right, is at stake. And I'll run you through that. So it's a combination between the probability that something will happen, right? It's the combination of the probability that something would happen and the consequences that might have, right? And this is where kind of the hazard, what that is the exposure, right? The hazard, the exposure, and the vulnerability come into place. And adding this response also makes us think that the very response to climate change, the very thing that we are doing to try to improve climate change, might actually add or diminish risk. So it's important to think of risk not just in the exposure, the hazard, or the vulnerability that it's out there, right? But also of the responses that we are creating. And I know through this course, you've learned about strategies that reduce the risk to climate and health consequences. But when we add response, we're obliged to think about the unforeseen consequences, or what sometimes we call non-intended consequences that we have with our climate responses. So some of these might be things like, oh, let's say we are doing mitigation strategies and adaptation strategies in our communities. And some of those might be something like, oh, we're adding more trees to our forests, right? And the response at a first glance, it might be, oh, this makes a lot of sense. Planting trees makes a lot of sense. But if we plant those trees and then we are exposed to a future where drought is a reality and higher temperatures are a reality, there might be a probability that that response, the planting of trees, might signify an increased risk of things like forest fires, right? So when thinking of our risk profile, it is not just important to think about these three things, which is what I think you've traditionally learned in your previous classes, but think about the response and the role that that is playing also in the risk profile of individuals, communities, and society. So remember the unintended consequences or the unforeseen consequences. And this obliges us to think about that, not just in the most immediate sense, but also in the future to come. So this is where modeling becomes really, really important. So if we want to understand risk in another more easier way, and this is kind of just a graph to show you how we can classify risk. And usually we speak of low, medium, moderate, high risk, etc. Right? Again, we think of these two things: the probability of an event happening and the consequences of that event. The probability and the consequences on that we deem valuable. And this is from the IPCC 6 assessment report, which I know you are all now familiar with. Its thousands of pages. You probably have read either executive summaries or part of those reports. But if the probability is rare, let's say if let's say a forest fire or a flooding is rare, or a landslide is rare, or a mosquito outbreak is rare, right? And the consequences of having that is negligible, we usually say it's low risk. But in the other end of the spectrum, right, and this is just risk classification, and there are assessments that you can do in your communities and in your countries and in your provinces and in your cantons. There are different levels of risk assessment that you can do that take into consideration different variables that we can speak of later. But this is just a broad overview of how we understand risk, right? This is, again, how climate can affect a risk. So this is one concept I want you all to be clear. Again, going back to our simple definition, risk is the potential, right? The potential of consequences where something that we deem valuable is at stake. So that is risk. Now let's go to this other concept, which is a vulnerability, right? And although there is no widely stated or widely cited definition of vulnerability, and there seems to always be an evolution between the definitions, there is no single correct or best conceptualization here. We want to pick out some elements of vulnerability that makes us clear on what we are talking about when we're talking about vulnerability in relation to climate change. So if you could type into the chat what you think is meant by vulnerability, I'll write down some ideas here in the slide, and then we'll take it from there and try to define what vulnerability is and what vulnerability is in the face of climate change. So give me some ideas there on how you understand this concept of vulnerability. Now I'll stay silent for a while you think about that. More likely to be affected in a negative way, exposed, all right, affected, negative, the ability to recover, more susceptible, preparation, reaction, resilient, timely, ability to cope, risk. Okay, I've been writing some of these down at higher risk. Now, what I see from some of the sensitivity, what I see for some of these, and I'm sorry about my handwriting there. I am an MD after all, and we're supposed to have bad handwriting, so they say. What I'm seeing some of the messages that you're writing in the chat is that there's some maybe a confusion on when we're talking about vulnerability. Are we talking about the opposite of vulnerability or the other kind of sister concept, which is a resilience? So some of the things that you were writing in the chat resemble much more resilience than vulnerability. And again, I started this by saying that there is no widely accepted kind of universal definition of vulnerability. So there was no wrong or right answer here. But there are some elements that I want to pick out of the things that you were saying around the concept of vulnerability. So again, I'll try to go piece by piece of the definitions that exist out there, and I'll then cite the IPCC report definition of vulnerability, which you might look into. So when we're talking about vulnerability, right, we're usually talking about vulnerability of something, right? So we need to define what that something is. It might be of a species, it might be of a human or an individual, it might be of a community, it might be of an infrastructure, it might be of a system, it might be of a society as a whole, it might be as the planet as a whole. So there's several elements in the scale of vulnerability that needs to be taken into consideration when we're talking about vulnerability, right? It's not the same to use vulnerability for, let's say, a bird, right? Vulnerability of a river, vulnerability of ourselves. Those are different scopes of vulnerability. However, the concept itself are still applicable. And I see Michaela saying there's also different vulnerability profiles, and of course, between, let's say, different demographic or other types of categories. So what I want you to think about, right, when we think about vulnerability, is the concept of how susceptible is, again, the element that we're describing, be it the individual, the species, the community, the society, how susceptible, right, that thing is to adverse effects of, in this case, that we're talking about climate change. So susceptibility to climate change. That's one of the elements that we're describing here in the concept of vulnerability. And then the other element that we're trying to describe here with susceptibility is the inability to cope, right? The vulnerability has these two elements. One is the susceptibility, and the other one is the inability to cope to whatever climate variability or climate extremes we are talking about. And that definition, the susceptibility and the inability to cope, is a function, right, of the magnitude of whatever risk we are exposed to, right, the magnitude, but also the character, the type of risk that we are exposed to. So again, I can't write this word. This is a really hard word to susceptibility, one, and inability to cope. All right. Some of the elements that you were describing there, right, like resilience, sensitivity, negative impact, preparation, can be understood as part of some of these definitions or elements, as I'm describing them, of the concept of vulnerability. And we can speak of that in just a second. So another way, just a graphic way that I want you to think of vulnerability, is the way the IPCC it describes these things, right? And I saw some of these terms that you were using in the description in the chat that relate to the terms that IPCC and other climate panels and experts are using. And those are the ones of adaptive capacity, sensitivity, and exposure. And some of you wrote those in the chat. So I'm going to run you through some of these. So exposure, right, is the external component. I want to start by saying that exposure is the external component of vulnerability, and it's defined as the contact, that contact point between whatever we're describing, the element, the person, the system, the institution, the infrastructure, the community, right, is that contact between that and the climate. It's what it's impacting from the inside, outside, to the element that we're describing the vulnerability to, right? So that's exposure. Then there is sensitivity, right? And I'll explain this seesaw in a second. The sensitivity is described as the degree to which the system is affected, right? The degree to which the system is affected. And that is what we described as the internal component of vulnerability. So if exposure is the external, sensitivity is the internal. It's very similar, if you think about it, to the concept of, let's say, immunity, in the sense that, let's say, if I have a good immune system, that's something internal about me, the exposure, right, the exposure to a harm, let's say a virus, to use an example that is very relevant now, right, the harm will be reduced, the risk is reduced, my vulnerability is reduced, because I have a low sensitivity to that exposure, right? So it's important to combine these terms when we're thinking about vulnerability. And as you can see here, the more sensitivity, the more exposure, the higher degree of vulnerability. And this is what they're saying here. The lower, right, the lower, and this is, you have to imagine these being weights, right? The lower sensitivity, the lower exposure, the lower, the higher, the lower your vulnerability. So I'm going to run you through what adaptive capacity is here, and then we're going to graph them here. And then adaptive capacity, as is described in the literature, is referring to an ability of, again, whatever we're describing, individuals, species, ecosystem, infrastructure, a society, community, whatever we're describing, right, refers to the ability of that we are describing to develop an adjustment to the climate risks. And of course, this is a function of different elements like financial capacity, technology, social networks, social capital, community resources, etc. And again, the higher, right, the higher adaptive capacity, the lower your vulnerability. And when we see this in this graph, if we were to map sensitivity and exposure and adaptive capacity here in the x-axis, vulnerability is a function of these three things. The more adaptive capacity that you have, lower vulnerability you will have, right? The higher sensitivity exposure, the higher sensitivity and exposure, the more vulnerability you will have. So these are combined terms, but it's important not to confuse them with this other term that we're going to see in just 1 second, which is resilience, that has to do with these two terms. Remember, these are, sensitivity is internal term of the element that we are ascribing vulnerability to. Exposure is the external to whatever we're ascribing that sense of vulnerability to. And adaptive capacity can be either internal or external. So it's important to distinguish some of these differences here. Now, let's move on to resilience. And if you need me to go back to some of these concepts, I'm happy to go through them again. Now, right in the chat, similarly to what we did with vulnerability, what you want to or how you think of resilience. What are some elements? How do you define it? What comes to mind? So go, chat. Ability to cope, yes. Recover. So I'm reading a lot of ability to recover, bounce back, adaptability, right? Ability to cope, stability, adaptability. All right, thanks for writing those. And yes, all these elements that you are describing here are part of the concept of resilience. And again, when we are thinking of resilience, we need to make sure that we are clear on what scale we're talking about. And again, we might be talking about an individual, a community, an infrastructure, a system, society as a whole, planet as a whole. So it's important that these concepts can be applied at different scale. So the way resilience is defined in the literature, it refers to that you are saying. It's the ability to cope, right? But not just cope, not just say, hey, stop, I am able to take this amount of exposure and not suffer a consequence, right? That is kind of the ability to cope, but also the ability to recover in case some damage or some hazard has been incurred. And the way it's not just that, right? But the way it responds, it reorganizes in function of maintaining whatever the essential identity or the essential structure or the essential function was of that we are ascribing resilience to, right? So again, it's important to understand that this concept can be applied to many different elements. And when we are talking about how it bounces back, so to speak, and we'll talk about that concept of bounce back in just 1 second, we're saying that that element, people, community, individual, species, infrastructure, ecosystem, resilience relates to the ability for it to maintain that essential function, that essential structure, that essential identity, right? So it's the bounce back is a good metaphor, bouncing back to its original state, right? And some people use the rubber band, a metaphor, to think of resilience in the sense how much resilience you or community, or again, those elements have relate to your ability, the ability of the rubber band to come back to its original state. Now, when we're thinking about bouncing back, as I saw someone write in the chat, the concept of bounce better or bounce forward, because we need to think sometimes in our communities that have a baseline of poor conditions, right? A poor infrastructure, poor access to water, poor access to quality air, poor access to quality healthcare. And when we're thinking about bouncing back, we usually do not want to think of returning to the status quo, because the status quo is part of the problem, right? The status quo is part of the elements that got us into this conundrum in the first place. This status quo had high vulnerability and low resilience. So bouncing back might not be ideal. And sometimes you want to take the opportunities as you're trying to bounce back to bounce better. That is, if you're rebuilding infrastructure, you want to build resilient infrastructure. If you're building policy, you want to make sure that that policy is trying to capture the people that are most at risk. If you are rethinking of reorganizing the actions of your health system, you want to not just go back to the status quo. Again, you want to see how you can actually make leaps forward. And sometimes in the moments of hazard, in the moments of a high risk, is where some countries have the strategies and the leverages to actually build back better. And I'm thinking of countries that might have laws, let's say emergency laws, that allow the pouring of resources into this build back better, this bounce back or bounce forward. I mean, this bounce back or bounce forward a component. So again, resilience takes into consideration the ability to cope, the ability to respond, the ability to reorganize, while maintaining essential functions, identities, or structures. So those are the components of resilience, right? Not just bouncing back, but bouncing forward. So I'm hoping that those concepts were clear. We talked about risk, we talked about a vulnerability, and we talked about resilience, right? And they're all interrelated concepts. They're not independent concepts. They're all interrelated. And when we look at an individual, a system, a community, a society, a country, or a planet, those all have elements that they share. Risk, vulnerability, and resilience all are intertwined concepts. Now, I know I'm going to move on to my next part of the presentation, which is talking about models to understanding how health and climate are related. Now, I know you've seen these throughout your presentations. I actually took these from the presentations that you've already seen. Some are more country specific, some are more global specific, but what they all have in common is that they're all taking a determinants of health vision, in the sense that they're taking the different elements that influence our health, right, and trying to equate them in the function of climate change. That is, taking climate change as one of the determinants themselves, but also trying to understand how climate change affects others' determinants of health. So in essence, what they're doing is they're taking the classic, and this is just conceptually speaking what they're doing, they're taking the classic understanding of the determinants of health, which I know many of you, if not all of you, have seen these more kind of old models of determinants of health, the WHO Commission on Social Determinants of Health, and the Dahlgren and Whitehead model, which are basically saying, right, health is impacted not just by our lifestyle choices, not just by our genetics, not by just behavioral factors, but there's a flurry of different parts of our ecology, and these are ecological frameworks, or some might be called onion layered or different words, but there are elements out there that also have an impact in our health. Things like policy, governance, health systems, race, gender, education, etc. Right? Place of where you live, the place where you work, the place where you grow up. All those things impact your health. And what these are doing is accommodating that same concept in lieu of climate change. So I'm going to run you through this other model, which is how I like to think about the determinants of health and how they impact health, in order to understand the fact that whatever you put here, and these are the determinants of health that classically are referred to: macroeconomic context, the policy environment, the different governance mechanisms, education, cultural context, access to justice, health systems, labor conditions, food production, land use, etc. And if you remember my first question, what factors make a person or a community more susceptible or resilient to others like climate change? All these are factored in there, right? Think of, let's say, how social capital influences someone's exposure or risk or adaptive capacity or resilience or vulnerability to climate change. Think as you are seeing these, start thinking of examples on how those things are related, right? Climate change and these determinants of health. Take a minute to just choose one and say it, right? Take a minute there. And as you're seeing the obvious ones, right? If you're seeing, oh, of course, socioeconomic status, the more, let's say, access to economic resources you have, it's likely that the quality of your housing will be better. It is likely that where you are building that house also might be at lower risk. It also might mean that if there is a catastrophe like a hurricane, you might have the means to migrate, right? So that's just choosing socioeconomic status as an example. But we can go one by one and trying to express how these determinants of health, right, will react, right, to the exposure of climate events. Governance. So what I want you to visualize with this graph is not to just pick one of these, but think of them as a combination of factors that are actually floating around in this milieu, or this connective tissue, right? That is expressed in this gray little lines here. Because when you start thinking about it, and let's just take climate change out of the equation for a second, when you start thinking about these, all these are not just related in one, let's say, unilateral line, but they're related bilaterally amongst themselves, simultaneously, sometimes having compound effects, right? So if you think about things, let's say, to throw you an example, how is, let's say, policy environment related to land use, right? I can throw an example out there very clearly on how, let's say, some policy environments will allow indigenous peoples to take care of their own land, but some policy environments actually restrict what indigenous peoples can do with those lands. Some policy environments are actually allowing the encroachment and the loss of land, right, for people, for indigenous people, and that puts them at risk of either being highly mobile or having to migrate, losing their livelihoods. So let's say these two are connected, right? But at the same time, that is connected to food production, and that is connected to the labor conditions, and that will connect back to socioeconomic status. And if we continue to do that and trying to find ways that these things are connected, we'll quickly notice that this is a network and that this is all interconnected and intertwined. And this is why I have these little gray lines back here. So it's important to think about the determinants of health as these intertwining, these connected, interconnected, happening simultaneous. And they're all interacting with each other all the time. And who you are, where you are, and what time you are, all play a role here. It is not the same to be in Curacao than to be in San Jose, Costa Rica. It is not the same to be in the coastlines of Bangladesh than to be in San Juan, Puerto Rico. Those things, who you are, where you are, and what time you are, all play a significant role in how these interact. And which of these has a bigger weight when it comes down to health. And here, what I try to draw here is that health outcomes can either be positive or negative, depending on the combination of these factors. So it can be either a good health outcome or a bad health outcome, depending on who you are, where you are, what time you are, in consideration of these factors. And the way I conceptualize health, and the way I tell my students, is that health is actually a dynamic, ever evolving product of these eco-social systems. It's like a web, exactly. Now, let's bring back climate change into the equation. Climate change, in a sense, and as kind of has been shown in several reports, climate change acts as a threat multiplier. Climate change, with its effects, right, that it's having over the biosphere, has a reverberation that is, it impacts all the determinants of health. It reverberates in them. It changes the way they behave, so to speak. It changes the weight they have in this equation of health as a dynamic product of an eco-social system. So when we think of this, we not have to think in linear ways, is what I want to say here. We have to think about this in how climate change is affecting the systems that underpin the very essence of our health or our poor health outcomes or disease, right? So think of health as climate change as a threat multiplier that has these little wiggly lines here. I call these reverberations, basically like vibrating through the whole system and changing how it's accommodating, right? So the conformation of the determinants of health model changes, and the outcomes hence change as well. Think about the three variables that I said: who you are, where you are, what time you are, relates to this. And the reason I'm saying what time, and I'll talk about this in a second, is because climate change, resilience, risk, vulnerability, adaptive capacity, all those elements of definitions that I just showed you, it's important to think about them not just in the now, but also in the future. So what time you are is what I mean by that. It's not just today, but it's also in the future. Let's say it could be in the next rainy season, but it also could be 10 years ago, 10 years from now when we hit 1.5, but it can also mean 25 years ago, 25 years from now when we hit 2.0 degrees above pre-industrial levels. So hopefully those scenarios won't happen, but those all have to be taken into consideration when we're thinking of climate change as a threat multiplier. Now, the other thing I want you to think about very clearly when we're thinking about climate change inequity is the fact that climate change does not happen in a vacuum. It not only reverberates to all the determinants of health that we were showing you, but climate change itself is only one element of these ecological drivers of changes of burden of disease. And what you're seeing here is what we call the Planetary Health Framework 2.0, and this hasn't been published, so just careful sharing it. But what we're trying to express here is that there are drivers, there are changes in our natural systems, what we call anthropogenic changes, that is human-made changes, that are causing changes in patterns of disease, be it infectious disease, non-communicable disease, nutritional disease, mental health issues, or sexual and reproductive health issues. Climate change is just but one of those anthropogenic changes of the natural environment, because of course we must also pair that with things like global pollution, the pollution of our air, the pollution of our soils, the pollution of our water, in general, the pollution of our biosphere. But I like to speak of those three elements, water, soil, and air, as key drivers and interconnected with climate change. We're talking also about biodiversity loss, altered biogeochemical cycles, basically the cycles of nitrogen and phosphorus, and the effects that they'll have on ecosystems, especially soil and water ecosystems. We're talking about land use and land cover change. We're talking about resource scarcity, especially freshwater resource scarcity, and changes to our oceans. Now, when you think of climate change is just one of these elements that causes a change of pattern in diseases. But climate change is also connected with things like biodiversity loss. And you might have learned some of those connections in your previous class, right? And I can think of, let's say, just one example on how climate change is connected to biodiversity loss. In my country, amphibians make up a huge amount of biodiversity, and they live in very, very humid, very, very tropical forest environments. And it might be the case in many of your countries as well. When we are making the earth warmer and drier through climate change, that humidity tends to lower, the amount of cloud coverage, the amount of humidity, the amount of rainfall becomes different, right? It's sometimes hard to predict if that goes up or goes down, or if it's intensity, but it changes. And the species per se, right, in this case, amphibians, aren't able to adapt as quick. That is, they have very low adaptive capacity. They have very low internal, let's say, resilience, right? And they have the exposure. So again, we're combining those terms. And what happens, that biodiversity is lost. So we've lost hundreds of species and amphibians in the tropics. And what the role they play in the ecosystem, right, is vital, of course. So climate change is connected to biodiversity loss. But at the same time, biodiversity loss is connected to land use and land cover change. That is, it might be that palm oil is coming around, or pineapples are coming around, or bananas are coming around, or cattle ranches or soy ranch. So we're losing soil, and it's related to biodiversity loss. But at the same time, that is also related to biophysical ocean changes, in the sense that if we're taking down forests to plant soy, that means more nitrogen and more phosphorus are coming into the waters and to the soils, and that is running off to the rivers, and that is running off to the oceans, and that is changing the fact that the amount of sediment, the amount of pH, the amount of species, it's changing the biophysical conditions of the ocean. And at the same time, that is also climate change is related back to that. In many ways, the ocean is getting warmer and it's getting more acidic because of the amount of CO2 emissions in the atmosphere. So what I want you to see here, and if I continue this example, and if I had 2.5 hours, we could continue to see that all these, similar to the determinants of health, are happening simultaneously at the same time, and they're having compounding effects. and this is what we call sometimes in climate science, that the consequences of these acting together might reach tipping points quicker. Tipping points are places where the rate of change accelerates, right? Where the rate of change of, let's say, the rate of change of how fast Arctic ice is melting accelerates. The rate at which biodiversity is being lost accelerates. The rate at which eutrophication is happening accelerates, right? So when we think of climate change, we also, again, we must link it to these other concepts or these other global phenomena, environmental phenomena that are happening. And I won't stay in this graph for a while, but this is the concept of planetary health that I think Renzo spoke of recently. So run you through some examples. And when we look at different scores of vulnerability around the world, obviously we see that that the vulnerability scale, that is the amount of how vulnerable communities are, and these are defined by food security, water availability, living conditions, ecosystem services, infrastructure, including things like energy and the dams and dikes and others, right? When we look at vulnerability index scores, and this is just one, there are many ways of measuring vulnerability. We'll usually see this trend that in the tropical areas where we all live, where the majority of all lives, is where the highest vulnerability lies. Not necessarily because of the nature of the effects that climate change will have on the tropics, which is also very important, but because of the nature of the systems that underpin whether you are resilient or whether you are vulnerable. That is lower socioeconomic status, lowest access to technology, lowest access to proper education, proper health systems, etc. Right? So it's a function of those two things: the exposure, which is the amount of change that climate change will cause, but also in the tropics, but also the lack of resilience that some of the systems that we live in have, but also the increased vulnerability, right? So this is a function of all those three things connected.
Carlos, we have 5 minutes left.
And I know I'm running out of time, so I'll try to think of which are ways to think about this. So the example here of, let's say, a nutritional risk or nutritional health, right? And I told you what we were trying to explain is how different populations are more at risk than others, or they're more vulnerable or have less resilience, less adaptive capacity. So let's think about this phenomena that we knew very or relatively little about. We knew, right, and it's always been said, oh, CO2, well, plants eat CO2, so more CO2 will likely be good for plants. Well, we know that we scratched that out a long time ago, and most of science now really is leading to saying that most crops will actually reduce their yields in higher CO2 environments, right? And that is something that we know. Now we're trying to understand, and we're starting to understand, thanks to emerging research, that it's not just the quantity of the food that will diminish in the face of climate change, right? But it's also the quality of the food. And when we think of these main staple crops or staple crops that are eaten by around 2/3 of the whole world population, eat these as their main source of calories, be they wheat, rice, maize, soybean, etc. Right? When we think about these, climate change will not only signify a reduction on the yields of these in the majority of the world, but they also will signify a reduction in the quality of the micronutrients in that food. So things like zinc, iron, and protein will be diminished. Now, who is at more risk here of developing then a disease or elevating their risk profile, reducing their resilience, right, increasing their vulnerability when this happens? It is the people that are at the baseline or borderline. Think of a little kid in a community that is borderline anemic. Now think of that same kid 10 years from now, in which now under the expected levels of CO2, the amount of zinc, iron, protein that they're receiving from their main staple food, be it wheat, rice, or maize, is diminished. That child, that same child now, or in 10 years from now, and that's why where you are, who you are, and what time you are becomes important, is going to now fall in a new risk category that will put them at risk of things like not just anemia, but the consequences of anemia, the consequences that come, such as a lower capacity of the immune system to react to parasitic diseases, and the consequences that will have. Think of a mother that goes into a new pregnancy in these conditions. The consequences that it will have in that mother, that new risk profile that the mother adapts, right, when they're living in this borderline between healthy or unhealthy and very unhealthy, the risk profile changes. So this is some of the emerging science that we're starting to see on how some of these unexpected changes are are now part of how we understand risk to these natural changes. So going back to this, remember that what we're trying to do is, how are these human-caused changes to natural systems impacting the burden of disease when it comes down to infectious, non-communicable, nutritional, mental health, and sexual and reproductive health. And some of these, when we're thinking about it, and again, remember, we're talking about interconnected elements, interconnected systems, interconnected nature of the determinants of health, how climate change is reverberating through that system, but also the interconnected nature of the ecological drivers. It not just will mean that crops are less available, they're less healthy, so to speak, but also they will become more expensive. So again, that compound effect will definitely put more at risk the populations that are already more vulnerable, right? So the consequences might compound to new forms of risk, to new health outcomes that we are still unable to understand, because we were trying to measure this in linear ways and not think about this in systemic ways. And now lastly, and I'm almost done here, lastly, I like us to think about the responsibility of climate change. And I know you've seen these graphs before. I want to make a big emphasis here, in which we're going to talk about who bears the responsibility of the emissions that are driving climate change. But in the same way, I don't just like to talk about carbon emissions growth. There's also responsibility of pollution, right? The pollution, I said, of our air, of our water, and our soil. But also who's driving the changes in our ocean, who's overfishing, who is eating that fish, where is that fish going, who's financing those fish large captures. Or if we're talking about agrochemicals, who is driving the use of those agrochemicals? Not where are these used, but who is driving the use of those agrochemicals? Because it might be unfair to say, oh, soybean, yes, represents a huge amount of the amount of agrochemicals that are used in the Americas, which is mainly planted in Brazil. But who drives the use of soybean, and what is soybean being used for? Soybean is mainly being used for feeding cattle that is then feeding mostly diets of high income, middle income people, not lower income people. The same way we think of palm oil is being planted mostly in the tropics, but who is driving the plantation of forests of palm oil? Who is driving the deforestation that precedes palm oil, right? It's not the where, but what driving force, which is part of the equation here. So no matter which anthropogenic change we are seeing of our natural systems, these curves usually stand up, not just for carbon emission growth, but all those others. And the curve or the graph might not look exactly the same, but the brunt of the responsibility will lie on the people that are consuming the most, right? And sometimes that means consumption is a proxy of wealth, right? So it is the wealthiest, and again, I'm not speaking here of just the wealthiest people in the United States, the wealthiest people in France, in Germany, in Canada, and Australia, because all countries have these higher income populations. So there's an important distinction there to do. And I know Cecilia just turned on the camera, which I know means something. Now, finally, and I'm almost done, I swear. Give me 5 more minutes. Is that okay? Oh, you're muted. You're muted, Cecilia. I couldn't hear you.
Oh, yeah, it'll just cut into our question and answer time, but your call.
Okay. So just want to say that concept of intergenerational equity, and I introduced this concept of the what time you are becomes important. But this is a really recent report was thrown out by UNICEF, basically saying that there is some not just geographical aspects that we need to think of, that in the sentence, and the quote is, in some cases, we are seeing countries providing relatively healthy environments for children at home while being among the top contributors to pollutants that are destroying children's environments abroad. It is important to think about this concept geographically, in the sense that where is the damage being caused and who bears the brunt of that damage, right? Or the let's say the pollution or the greenhouse gas emissions, but also in the future, right? In the future, what are the consequences of our actions today? So the concept of equity must not just think about the now, but also think of future generations. And they must be, the people in the future must also be thought about as people that are right holders, that have basic right to earth resources like our water, our clean air, our healthy soil, climate stability. All those become essential rights of future, of people living in the future. And just to run you through this important graph that I've kind of that I'm using here, this again not published yet, but one of the reasons that we are slow to act, is because, and what we're seeing in this graph is we have here degree of environmental change, and in this graph we're going to use climate change, right? Degree of climate change, and then we have health gain and health loss, and we're plotting two graphs. One is people with more power and populations with less power. Now, I'm not using here high income countries, low income countries, global south, global north. I'm using the concept of power, right, as a proxy of people or populations that have access to economic resources, but also natural resources, that hold access also to technology, and that have power or voice to influence global policy, and also have social capital. So people with more power are paradoxically seeing an increase in their health. And this is what all trends are telling us, is that most populations, paradoxically, that are of the high income brackets, and even some that are middle, and even some that are low, but people that have power are paradoxically still seeing some health gains that are kind of a legacy of the changes that we've made in the technology that we've been able to develop. But the populations with less power, and again, people with less economic resources, less natural resources, less access to technology, less power and influence over global policy, have already started to see a decrease in their health gain for this. And that is increasing the amount of health inequities that exist today. So if we are to think of equity, we must think with the populations that have less power to influence global policy, less power. And this is why bringing them into the conversation, providing a voice, allowing them to be part of the conversation becomes essential to close the gap in these health inequities. Because if not, this inaction that we're seeing today, the inaction that we're seeing in which we are not on track to our Paris Accords, we are not on track to the SDGs, will continue that trend into the future. And then it is populations with more power that are still will start to see a detriment. Now, what is your role here then? Your role as a health professional is to first understand the science, and I think a lot of the things that you've been doing in these 10 weeks is or several months is knowing your science. It's vital that you understand what you're dealing with in the face of these global environmental changes. You also must understand that some of these actions are actually win-win scenarios, and when you're planning them, sometimes it is good to work with other colleagues that can help you graph these win-win scenarios, because it'll help you make your case on these solutions much better than if you were doing just standalone health. Usually health benefits will come also with other types of benefits. So working in interprofessional teams becomes something that is vital when you do the next point, which is advocacy and change at a structural level, which usually comes by speaking to decision makers. Now, you might be the decision maker, or you might be close to the decision maker, or you might know the decision maker. Now, how do you communicate those win-win scenarios is incredibly vital to have that very clear. And then not just thinking of change from this arc of change that is, oh, knowledge creates change, because knowledge feeds into policymakers and then they rationally act to create change. We know that that's not usually the case, right? We know that change doesn't always happen that way, or that arc of change is very slow. We must also build from the base. So planetary health and climate action needs to be an and field. And by that, I mean, it's not an either or field. It's not, oh, policy change or movement building. It's an and. It's not just, oh, benefits for health. It's benefits for health plus benefits for the economy, plus benefits to social well-being, right? So thinking an and becomes an imperative of our climate agenda and broadly our planetary health agenda. So if you want to take a screen, oh no, these will be available. So I'll stop there because I know there might be some questions, and I appreciate the questions and your attention. And I'm sorry I went around 10 minutes over, I think. Get excited.
That's okay. That's okay, Carlos. We enjoy hearing your voice, and we enjoy all the words of wisdom that you're giving to us. I know we probably would be close on time, but I think it is very important, especially those very last slides that you showed us, because we now see our responsibility as leaders within the Caribbean, that we need to get our voice together, because we need to represent the people, because we see ourselves as the persons who would make that difference in our region. I also would like to thank you very much for helping us to define the words of like exposure as external, susceptibility as internal, because once we get these concepts right, it can help us in our building our adaptive capacity and our resilience. And I like the way how you redefine the determinants of health that went beyond the social determinants of health, because you help us to understand the intersection of all the different components, especially how we must get and think about the environmental determinants of health, the governance, the policy, the land use, the building of the social capital. And it's not just the social determinants of health, but we need to take all of these as an intersecting web if we are to address the problem carefully. Without much ado, I know Cecilia is very anxious to get the show on the road, and I'm sure there are people who would have a few questions for you, and we have a few housekeeping notes that we need to address. So let us get to that first, and then we would take your questions for you, Carlos. Is that okay, Cecilia?
Sure, sounds good. So we will, you want to do the questions for Carlos now, or you want to do them after the closing, Paula?
Let us get through the housekeeping notes, because if we rush it, people will feel that they're not connected. Okay, and as I told people, I know a lot of people are feeling really bittersweet. I know at the end of these conferences, we have this great high, and then as it closes, we feel like we are dropped. And then, so no, we want people to understand that this is not the end, that we are going to be connected again after that. I also want people to know at this point in time that you have heard our voices, and all the all the members of the board put on their videos if possible, so people can, because they have to say goodbye to us. And I want you to know that we want to hear your voices. So we are giving you the opportunity to link with us, right? So we are having country chapters that you will hear about. We're having webinars where we have breakout groups. You have heard us, and we need to hear you now. So this is very important part of the carrying on the discussions. And so just wave your hand so everybody knows this is me. I'm Paula Henry. And Lauren, where's Lauren? Lauren, I'm not seeing you. Okay, but Lauren was very important in getting this together. Of course, everybody knows Dr. Hospitalis. Haley is a silent partner, but she's the one that made sure that we were all together. And of course, Cecilia was the driver. She was the driver that made sure that we kept time, that we got it together, that we got everything in order. So thank you to the working group. And of course, we have to say thank you to our tremendous faculty from all over the globe all continents, even people like Renzo from the Philippines, who took time off their schedule to give us so much of their intellect free. We didn't really give them anything, just mainly a thank you. Next. Okay, so this is just to remind us of all of us who got together, and you can't see the small ones, but we had people from Fiji, Nigeria, and you can read it all there. So we're happy to have everybody on board. Next. Okay, so this is a reminder, if you want to get a certificate from Columbia, it is very important that you do the exam. The link will be posted in the chat, and you can do it anytime, but you have 1 week to submit your answers, and that is until midnight on June the 15th, which is 1 week from now. You can scan the QR code, take the exam, or you can connect it, get it from the chat. I think everyone will get it once we close the session. Haley will email it to you. Remember, you have to get 70% or more in the test, so be careful of how you do it. And you must have attended 7 or more classes to get a certificate from Columbia. Next slide. Okay, so the course survey. Many of you would have taken this at the beginning of the course. It is very important that you give us the feedback survey at the end of the course. In that way, we would be able to actually improve our game. We want to know how much you have learned once we have looked at the gap. So please give us your feedback, right? We are also posting that in the chat. Next slide. Okay, so now Dr. Hospitalis is going to take over and tell you how to connect with us. This is just the beginning, guys.
Thanks very much, Paula. I am feeling happy, and I'm also feeling sad that we're at the end of this course. But you know what? Estamos empezando. Nous comenzó. We are beginning. Nos ponemos en camino. We are on the way as a result of this course. And I want to tell you some of the things that are going to be next, because the course is not the end. We're going to have a monthly webinar series, and we'd like you now to, I'm going to pause for a moment so you could pick your 5. Do you think we should have a monthly webinar on climate and health as a follow-up to this course? And then choose your 5 top topics and suggest others that you might like to do. So if we could just go back to the previous question, do you think we should have a monthly webinar as a follow-up to this course? Haley,
Sorry, Dr. H, I'm already running the 5 selections, but people are off to the races.
Okay.
We'll take that as a yes that we should have a follow-up monthly webinar.
Okay. We sort of, I didn't want to second guess that. It would be good to see a resonating yes, and people are putting yes in the chat, so that's great. And
also put things in the chat if we don't have them listed. We just kind of threw out some ideas, but we really want to hear from you on what would be interesting and what topics did we not address. There's so much out there. So please feel free to put any ideas you have in the chat as well. You can also email us anytime. We'll put our email in the chat as well. We want to hear from you.
Solar and health, that's a good one. Y salud mental health. Okay.
Yes. Sea level rise. Absolutely.
Yeah, we have that one in the list, sea level rise.
Oh, good. Okay.
Wow. Okay. Great. Great. Thank you all very much for this feedback. We'll use that in designing the monthly seminars for the rest of the year. War and climate change. Yes. Yes, Gary.
Future modeling scenarios. Keep them coming, guys. This is so helpful. We will do this all. Great.
One of our associates speaks about hunger, conflict, famine, and war in that sequence. Community part, the aged. Yes, sí, señor.
Okay, fantastic. Okay.
Food security. Okay, so that's really good feedback from everyone. It validates to some extent our ideas, and we can pick from that to do the 6 monthly webinars. Now, you heard what Carlos said, mobilize from the base. Mobilize from the base. So Earth Medic and Earth Nurse, if you've been listening to us, was set up to mobilize the health professionals of the world to wake up to the climate crisis and act on it to improve your health, the health of our society, and the health of the planet. And in taking that action, Carlos laid out a menu of getting better informed, getting better equipped, advocate with your policymakers, and so on. To mobilize from the base, we want to set up some country chapters, and we invite you to indicate your interest in forming an Earth Medic Earth Nurse chapter in your country. We're going to be emailing everybody who registered for this course with this link. Provide your contact information, and our chapter liaison will add you to our mailing list, invite you to chapter meetings, and support efforts to fight climate change. Registration is open until June 24th. And as I said, we'll be emailing this to everyone. 2 weeks ago, we were in St. Lucia, and I was very excited to meet a promising nucleus of folks who are interested to start a country-level chapter. So that may be the first place to do so. But we look forward to your feedback on this. Next.
Okay, so as Carlos was just mentioning, we need to be accelerating the translation of research and our experience as those people in the community who see health and who really take care of people, who really care about this. We need to take all our knowledge and take all our experience and translate that into policy at the local level, at the regional level, the national level, and so on. And so to facilitate this, we are launching an initiative starting this fall in collaboration with the Pan American Health Organization and the Inter-American Institute for Global Change Research, with the goal of bringing science to policy. And I'll tell you a little bit more about what this is going to look like. The first phase of this is that we are going to be assembling transdisciplinary teams. And what I mean by that is we want clinicians, we want mental health professionals, we want community members, we want public health professionals. Whoever you are, we want you to be part of this, and we want you to come together either as an individual or as part of an existing team. And then we are going to work to bring policymakers into these teams. If you're a policymaker, we absolutely want you. And we will be making regional teams. And these teams are going to go through as free, everything here is free, a free 7-week virtual training and mentorship. We will be working very closely with your team, making sure you have all the resources, everything you need to start doing some really incredible research to policy work in your space. After the 7 weeks of virtual kind of training and workshopping, we're going to have an in-person workshop at a place that's going to be determined. And we are really excited to kind of get all the groups together and spend some time in person. Phase 2, we will be working really hard to get our proposals together about the research that we need to do. And phase 3, there will be seed funding. So we will be funding these awesome proposals. We want to fund these teams. We want to fund them in the Caribbean. This is an area where, as you know, has vulnerabilities, but has incredible strengths and has so much knowledge that we need to share with the world. So we want you for this initiative, and we are going to put the link in the chat right now, and we'll be sending out a flyer. Registration is open for phase 1, and you can find out tons more about this on the website. So we look forward to seeing you at this upcoming course this fall. This is just a little description of who we're looking for. There's no one we're really not looking for. Anyone who's here who has been taking part in this course is more than welcome to apply. The next opportunity I'd love to tell you about is the work that we're doing at the Global Consortium on Climate and Health Education. And we have a mission to ensure that 100% of health professionals have the knowledge and skills to prepare for and respond to the impacts of climate change and planetary health changes. And so we engage academic institutions to sign on to the consortium and to pledge to train their health professional students. We also partner with NGOs. We have a student membership and we have an individual membership. We're putting the link in the chat right now, so you are welcome to join at any level to be part of this effort to increase education around climate and health for health professionals. So we currently have 270 members. This slide's a bit outdated. We have some members in Puerto Rico, we have members in Trinidad and Tobago, in the Bahamas, and we want more members from the Caribbean. So we invite you all to join. And this is just a smattering of our incredible organizations who we work with. including Earth Medic, Earth Nurse, Pan American Health Organization, and many others who are working in this space. So as James mentioned, this is really just the beginning. We continue to work night and day on this, and we're really looking forward to seeing everyone in some of our upcoming events. So I'll turn it back over to Paula for some final words.
Okay, well, actually, I don't know where Carlos disappeared to. We must apologize for eating up into his space. And that probably means we need to invite him again pretty soon, probably to have workshop and breakout sessions.
Oh, here, he's back, Paula, he's back.
No, I'm here, I'm sorry.
I know, he was just taking a water break. All right, so no, I know he's back. So the thing is, I'm waiting on my pilot to give me the questions. That's Haley. Normally it will appear on my screen, but it hasn't appeared yet. Haley.
Here, Paula, I'll toss it in the chat for you.
Okay, yeah, toss it in the chat so I could link. And Carlos, thanks again for that clarity and alacrity with which you delivered that lecture. It really helps us as we try to understand how we need to pitch our adaptive capacity and resilience as we go forward in this very difficult time when we have to think about so many things. Haley, did you give me the questions?
Okay, I've got some questions here, Paula.
I got one here. I got one here that I think it's interesting, which is from Christine Harry. This asks, do you think innovations in technology, example in food production, maybe better quality and quantity, can catch up or make up for the changes currently in effect with the climate change? This is a really good question because it's an actually ongoing debate, and there's kind of the techno optimists, right? The people that
We're not hearing you clearly. We're not hearing you clearly, Carlos.
Can you hear me clearly now?
Yeah, I think you're just talking a little too fast.
Oh, sorry about that. So this is an interesting debate because there's kind of a group of people or scientists that are, I refer to them as the techno optimists, in which they rely heavily in their models for the future that technology will likely be the one that puts the weight off the greenhouse gas emissions. So people are saying, "Oh, don't worry. The rush and the velocity at which technology is being produced will likely save us from this doom and gloom scenarios that we are facing." And there are some really very prominent books out there that actually say these kind of things. However, right, that seems a bit risky to be able to count on that the future of technology will be the ones. There will be some advances in technology. We'll see some efficiency come into our systems, everything from the use of energy to food production to our other technologies that we might not be aware of right this very moment, like some of the geoengineering that is going on. Some of that might help, but betting on that, I think, is irresponsible because it's betting on the health and well-being of the community that will have less ability to adapt in case those technologies don't work. So it's a matter of equity as well, in the sense that over-reliance on technology will get us probably in a very risky scenario. So I want to answer that question with, let's not over-rely ourselves in technology. We have solutions that we know we can model right now and that we can say safely will likely or very likely get us to a safe operating space for humanity. Over-relying in technology will get us at very risky scenarios.
Thank you, Carlos. Another question here from Joseph Antoine. I hope I pronounced your name right. I'm sorry if I didn't. The question is, what can all of us do in order to ensure that priority is given to the most critical issues in a timely manner?
Well, I think that's a really good question. And I think of my last slide, and it's a combination of things, right? I get asked this a lot, and in the sense that what can we do? What's the one thing we should be focusing on? I usually say, I don't want to fall into the trap of that question, because there is not just one thing we have to do. we need to think of ourselves as part of systems as well, as part of solution-seeking systems. And when we think of our actions, when we think of our work, when we think of advocacy, when we think of our research, when we think of our actions in the clinics and beyond, we need to see them as this part of this whole system that is looking for convergent actions. But in order for them to be convergent, we actually must be orchestrated in one way or another. So one of the things that we must do then becomes this coordinating body of actions. And that's what I mean by convergence, right? Coordinated body of actions that actually seek the same goal. So you might not be the policy expert, but you might be the science expert, right? You might be the health expert, and coordinating amongst the different sectors, providing what best, given opportunities for us to do what we do best convergently will become a key action point here. So don't want to fall into the trap. This is the one thing you need to do. We need to do a little bit of everything, but we need to converge.
We have a handout from Celia Poon Kang, one of our faculty. Celia, would you like to add to that?
Yeah, this was something, what Carlos has said, this final statement here, I think is the information that's missing from his very important slide where he reconceptualized the focus of climate change and the concept of social determinants of health, bringing it into the climate change arena. What tends to happen in a lot of these diagrams trying to link concepts is it compartmentalizes areas, and then what happens is the links between them are missing from the diagram. So he had the drivers, he had this, and he had, so you had all those, but it's like this systems diagram for the WHO health systems. It compartmentalizes all the different parts that are required, but the actual process of making systems work, the process part of it, the linking of the different components is not in it. And so just exactly what he has said in answering the question he didn't want to answer, you need to find a way to put it into that diagram, and then the diagram will be more people, when they see it, will be able to find themselves in it and then find a way through it to get to making climate change something that they can address from wherever they are. Does that make sense?
Appreciate the feedback. Yes, very much so.
Thanks. And this is a great question from Karanique. She's asking if there's any research that shows that involving Indigenous peoples and their perspectives will help in mitigating some of the effects of climate change in a way that will benefit people on both sides of the socioeconomic scales.
Well, not just mitigation, but also adapting. Indigenous peoples have been known to adapt to different living conditions in the face of everything from colonialism to new forms of colonialisms to different exposures to different diseases, among others, right? So there is a lot to learn from Indigenous peoples, and sadly enough, that's not published enough in the mainstream, let's say, scientific journals. But I would say that there is evidence. Some of that evidence might not be written in the way that we consider evidence to be valid. And that's another question that we should be asking. What forms of evidence do we consider valid? Does it have to be something like a randomized control trial where you take two communities and one community does this and the other community does this, and then we measure that in 10 years now and see who did better? That's kind of the classic approach to science that we have. But there are other forms of emerging evidence that we can actually rely on that does not necessarily follow this evidence-based model, this hierarchy of evidence. So I would say, yes, there's plenty of evidence out there, not necessarily in the form that we're accustomed to, but it's a matter of looking for it. And most of this evidence is contextual, which is the other thing that must be said about Indigenous knowledge, is that it's very context dependent. So it's not the same what's going on in New Zealand, where there's vast examples on how New Zealand worldviews can help the climate crisis, can help augmenting resilience, how can help improving health systems, etc. Right? It's not the same to say that to what's going on in the tropics, let's say in let's say Guatemala, in rural Guatemala, where the conditions are completely different. So contextualizing that evidence is really important, and not necessarily you'll find that in the form that we are used to when we think of evidence.
Thank you so much, Dr. Guzman, and for sharing all your knowledge. You're such an expert in this. We're just grateful to have you here today. And to all our participants, it's been wonderful getting to know you a bit over the past, oh my gosh, 10 weeks. We look forward to walking this road with you, really. We've got so much work to do, so much transformation to see together, and we are really optimistic that we as a health professional workforce can come together on this. So I'll turn it over to Paula and James for some closing thoughts, and look forward to seeing everyone soon.
Well, I would like to say thanks to everyone. You have been a great audience. Many times we have had a few hundred people on the call, and we're looking forward to meeting many of you in person as we continue this webinar series in different forms, and as we set up the country chapters. We are hoping to see many of you there. Over to James. You're muted, Jimmy.
Mute.
Jimmy, you're muted.
Yeah, I can see. Thanks. Thank you, Paula. Thank you, Cecilia. Carlos, excelente. Haley, Lauren, this has been the team working on it. You know, when we set off on this, it was with the realization that health professionals in the Caribbean had heard the phrase climate change, but people really needed to get better informed and get better equipped. And so I think this course, I believe it's helped to move us in the right direction. But as I mentioned, we're beginning. This is not the end. This is the beginning. Estamos empezando. I used to have a Spanish book in school that the title was Nos ponemos en camino, which I like the title. We're on the way. We're on the road. That was my secondary school Spanish textbook. So I'm feeling quite. Estoy emocionado. I feel emotional at this point, and look forward to working with folks to start country chapters. With the partnership with Colombia is going to be continuing. Last night we had a great session with CIMH, the Institute of Meteorology and Hydrology, all the tools that they have, and a lot of people in the audience said, how do we get a hold of those? So there's a hunger there to connect and get equipped and get empowered. If we're to have a chance on this planet, as Carlos showed, our small island states are the most at risk. Together with parts of Africa, together with parts of Asia, most vulnerable and most at risk. And so that voice from the South is another thing we wish to try to amplify, to tell the stories, to have more climate justice in this world. Look forward to working with you all. Thank you very much. Bye-bye.
Bye, take care.